How do we use food effectively in behavior therapy when the food functions as a trigger? I work with chronically dysregulated dogs, and often the ways that we might traditionally use food in behavior therapy actually increase the dog's stress levels, which is not our intent, but is the impact. So, what do we do? First, let's talk about why we use food in behavior therapy. We can use food in a lot of different ways. We can use food as management, where we might be distracting or redirecting the dog. Most often, we're using food to help the dog engage in species typical behaviors that lower stress levels, like sniffing, licking, or chewing. We might be using the food to create positive associations or to reinforce behaviors. We might even be using food to play. Food is often a really accessible and sustainable way to do these things. And so being able to use food in these ways is helpful. There can be a lot of barriers to this, and one of those barriers certainly can be that food in these contexts actually increases the dog's stress levels. The other reason we care about this, though, is because I want to understand the function of that. Why does the dog become so much more aroused when food is in the picture? And there can be a lot of different reasons. Sometimes we have a health issue going on. The dog wants to chew on something because they have dental pain, or they have acid reflux if their stomach gets empty. Sometimes dogs might have a lot of anxiety around food, sometimes traceable back to when enough food was not accessible to them. They may have been malnourished at one point in their past. There could be resource guarding behavior, which is also related to that anxiety around food that's presenting in a way that isn't immediately noticed as resource guarding. It might not be the food itself, it might be the way that it's being presented. For example, if I'm throwing the food for my dog and my dog is doing a lot of running back and forth, I might actually find that my dog is getting more aroused in this, this way that I'm giving the food than not. So there's a lot of data to be gleaned. Depending on what we think is driving those stress levels or the behavior that indicates higher stress levels, there are different things that we might do to make food a more accessible tool for the dog. I might suggest to my client that they try feeding their dog multiple smaller meals throughout the day. So the dog is eating the same amount of food as before, but more frequently throughout the day. And then we see if that has an impact. We might work out a way for the dog to specifically ask for food, to give them control over access to the resource. We might engage in an exercise designed around lowering arousal to food. That usually takes about a week or so, and I tend to see really good results with. We might really focus on using lower value food because for the dog, that low value food might actually be quite high value. And higher value food might absolutely make them out of their mind. And that one is more management of the situation than actually investigating the heart of why is the dog getting so aroused. But it can certainly be a helpful piece while we're figuring out the rest. So like anything else, we want to get curious. And we want to recognize when our intent is not having the impact that we want. And then we adjust.